Hey guys, welcome to today's Facebook Live. The topic is 8 shocking mistakes killing your neck. So I'm going to talk about the top 8 things that you can stop doing that will help alleviate neck pain. It's important to know as well that there's a really intimate relationship between the neck and the shoulder. So often what presents as a neck symptom, pain in your neck, might actually be coming from your shoulder or related to an issue with your shoulder or up high, your neck, your jaw. Hey, Sam. Hey, Casey. Hey, Keish. Welcome, guys. If anyone has any questions today, just type them straight in and I'll answer them as soon as I notice them popping up. How's everyone going? So vice versa, that issues with the shoulder will often be coming from your neck. An example is like if there's a compression in your neck or a lesion of one of the nerves exiting your neck due to a dysfunction in your neck, it might present as an instability in your shoulder. It might present as pain or numbness or tingling down your arm. So I'm not just talking about neck pain today, but things you can do to alleviate neck symptoms. So the first thing I'm going to talk about is tech neck, which is basically from iPhones and tablets and stuff. And we've seen an epidemic nearly of neck issues over the last 10 years from tablet and smartphone use. So when you're in a flexed position, you're looking down at your phone all day, which you're obviously not designed to do. It puts a lot of stress and strain on the posterior structures of your neck. It can change you posturally. It can lead to a forward head posture, which puts a lot of flexion through the lower cervical spine and will start to tighten up the upper cervical spine. This can lead to headaches, tension headaches, to dysfunction through, as I mentioned, the nerves exiting the lower cervical spine into your shoulders and your arms. So obviously, the less that you can be looking down at your smartphone, the better. You can put a timer on there. You can put limits on, like have a timer that goes off every 15 minutes and remind you to stop looking at it, because it's really easy to just kind of look at your phone all day nowadays. The biggest thing I've found is just get Facebook off your phone. I know a lot of you wouldn't even be watching right now if you didn't have Facebook on your phone. But if you get Facebook off your phone, I guarantee you'll spend a lot less time looking down at your phone and hence exacerbating tech neck. Hey guys, hey Kylie and Janet and Jen and Joe, welcome. I was just talking about tech neck. That was my first shocking mistake. The second one is very similar, but it's just workstation ergonomics. So, especially for people working at a desk at long hours, your workstation is incredibly important. Having your workstation set up around your dimensions is the most important thing. You want to have a chair or a Swiss ball or even stand, but have it set up so that it is at the height of your hips when your knees are at 90 degrees. So you're not getting your knees kind of jammed up or hanging down or anything like that. If you're sitting up straight, you want to have your monitor at eye level. You want to set your monitor up around your dimensions. So have a monitor at eye level rather than having your monitor down. If you have a laptop and you're looking down again, we see the same thing as with the technique where you see a rounded thoracic spine and forward head that leads to cervical issues with flexion such as herniated discs and radiculopathy. Basically, the biggest thing with the neck and shoulders is that the shoulder girdle is hanging off the neck and the thoracic spine. The shoulder girdle is only attached to the rest of our skeleton through this one joint here, the sternoclavicular joint. So if we're not in ideal posture upright like this, the muscles that attach your shoulder girdle to your neck are going to start to compress your neck So things like the upper traps and the levator scap that attach to your neck and then to your scapula, if you have a rounded thoracic spine from any of the last 2 points and a forward head, then those muscles are going to be pulling down on your neck, compressing the vertebra, which will lead to disc and nerve compression. Hi, Mark. Hey, Miriam. Welcome, guys. I was just talking about tech neck and workstation ergonomics and the issue of rounded thoracic spine and how forward head and rounded thoracic spine will lead to compression of the cervical vertebra, the discs, the vertebra in your neck, that can then lead to nerve compression, and the nerves that exit your cervical spine innervate your upper back, your shoulders, and your arm. Thanks, Joe. So a lot of these things that I'm talking about are related to posture, particularly those first two, which were tech neck and workstation ergonomics. The third one I'm going to talk about is breathing. So some other really important muscles related to your neck are the scalenes, and the scalenes attached to these first and second rib here and up to the cervical spine. I think it's C2, 3, and 4. I could be wrong there, I can't remember exactly, but they are accessory respiratory muscles. So when we're breathing diaphragmatically, when you're breathing with your belly, the scalenes should be relatively silent. But when you breathe with your chest, particularly because you're stressed or anxious, the scalenes do a lot of the work. They work to lift the top two ribs to create extra room in the rib cage. And if they get overworked and hypertrophied, they will start to compress the neck as well. They'll also start to pull you into forward head posture. The other thing is that the nerves that innervate your upper limb exit through between the scalene muscles there. That's the brachial plexus, and you get thoracic outlet syndrome, which is where those muscles are so hypertrophied that they will compress those nerves and give you pain, numbness, tingling, or weakness down your arm. So you can alleviate that, or you can massage the scalenes, but the big thing is to just override negative breathing patterns and breathe with your belly. And the best way to do that, I did the last video I did was on breathing, and I go through the breathing technique there. You can look at that on my business page. But it's just a reminder. I get my clients to have a little post-it note on their screen that says breathe, and just have a little timer that goes off every hour so that they remember to breathe and remember to check in. Basically you want to have your tummy rising as you breathe in and falling as you breathe out. Thanks, Kylie. So breathing is another important thing that you can do to alleviate neck and shoulder pain. The third thing is just being stressed all the time. If you're stressed, you're going to breathe poor. Sorry, that's the fourth thing. This is my fourth shocking mistake, is being stressed all the time. Firstly, because we're not meant to be stressed all the time. We're meant to enjoy life. It's meant to be fun and smooth, and when it's not, our body wears that. It wears stress, and there are a lot of dysfunctions that happen. But with the neck, there's the breathing that happens when we're stressed. Secondly, that we tend to tighten the jaw, that will lead to tension, headaches, to tension through the suboccipitals. That's the little muscles at the base of your skull there. When they tighten up, they cock your head back and bring your head forward as well. So you get forward head posture that leads to those other compression things I spoke about earlier. Basically, when you're stressed, your body wants to protect you, particularly your vital organs. So the muscles that protect you, like your upper traps, your scalenes, your jaw, your eyes, they all tighten up. So if you're stressed all the time, you're getting all these tight muscles that are pulling you into a protected position like that. It puts load on your neck, and as I mentioned before, it compresses the vertebra and leads to more shoulder and arm kind of stuff. Fifth shocking mistake is squinting, or I should say to have an issue with your eyes and to not get it checked out can lead to neck problems. If you're always looking forward all the time, if you can't see properly, or if you've got one eye that's better than the other and you're always kind of looking at that good eye, you probably do that unconsciously. But if you're doing that or that 50 times a day, that's quite a lot of reps to be rotating your neck or bring your head forward like that. That's going to lead to that forward head posture, or to worse, to a rotation in your neck that will exacerbate things and wear things out quickly. So if you think you have an eye issue, go and get it checked out. Go to an optometrist, get your eyes checked. You should be able to kind of sit back at a decent distance from your screen and not have to kind of be squinting and bringing your head forward all the time. Just even squinting, it's going to lead to headaches and stuff because it tightens up all the muscles around your eyes. That leads to all sorts of stuff. My sixth thing is having jaw and bite problems. So this is something people don't realize, but there's an incredibly intimate relationship between your jaw and your neck. If there's TMJ dysfunction, if there's inflammation in your jaw, it's another reason for forward head posture. Your body will reflexively bring your head forward to avoid wearing your jaw joints out. Because if you wear out, or if there's inflammation in these TMJ, which is your jaw joints there, if they wear out, you can't eat. And it's not this. Prior to dentistry, we wouldn't have survived very long if we couldn't have eaten. So there is a reflex that brings your head forward to prevent them from wearing out. The other thing is, if you have TMJ problem on one side and you're avoiding chewing on one side and you wear your teeth out on one side, your neck will always mirror your mandible here. So if your jaw is out even a couple of degrees to one side, your C1 vertebra will rotate the other way to balance that. So again, if you're getting like clicking, popping, cracking, anything like that in your jaw, go and get that checked out, because that can lead to neck issues. If you click your teeth together and you don't hear one clean crack, if you hear a slide or a slip or anything like that, that's a reason to go and get it checked out. If you put your fingers in your ears and just open and close your mouth, if you hear clicking or cracking in one side or in both, go and get your jaw checked out, because that will lead to all sorts of dysfunction elsewhere in the body, not just your neck, but in your low back and pelvis and everywhere. So that was my sixth thing, was having jaw issues and not getting that checked out. My seven is having a lumbar pelvic dysfunction and not getting that checked out. If you have low back pain or problems with your pelvis, any hip or pelvic pain, or even foot and leg stuff, go and get it checked out. This can lead to problems elsewhere. Think about this, I mentioned before that your shoulder girdle, that's your scapula and your upper arms, hang on your rib cage. And if you have forward head posture and around the thoracic spine, that they're hanging off the muscles of your neck, and upper traps and levator scap will start to compress the muscles of your neck. If your rib cage is the foundation for your neck, then your pelvis is the foundation for your ribs. And if your pelvis is out of whack, if it's twisted or rotated, then the rest of your spine is going to twist or rotate. Your ribs will not be rotated. There will be uneven forces on your neck. The body has a way of attenuating forces, and it's very hard to have a dysfunction in one part of your spine and not elsewhere. It's all connected. So get pelvic and lumbar stuff checked out. My eighth and final shocking mistake is one that's probably going to get a little bit of debate, which is not being truthful with yourself. So metaphysically, if you're holding your truth, if you're not speaking your truth, you just try. What does it feel like? You hold on to tension in your neck. And I've seen people get really bad chronic sore throats who know that they have something they have to say to their partner or to someone else, and at finally going to the length of discussing what it is they were feeling scared to discuss for so long. Their chronic sore throats went away. This is something where there's not such a direct link as the mechanical stuff that I've just mentioned, but working with people with neck and shoulder issues for long enough, you start to see a correlation. There is something to be said about not speaking your truth. So that's my 8th shocking mistake. So speak up, guys. Make sure you're honest with yourselves and with other people. And thanks for joining me today. If you have any questions, I'll stay on for another couple of seconds. If you want to shoot any through, that'd be great. Or type them up and I'll answer later by typing. Thanks, guys. Have a great day.